want to invite Eve Gray onto the stage. Eve is the director of our Health and Human Services Division at Lane County, and she's going to talk a little bit about our mental health crisis and some of the resources and innovative solutions that our community is pursuing in this space. We have heard this come up, obviously, earlier in the morning, but it's a challenge that our community is facing. How do we provide adequate services for the folks in need in our community? So we're excited to have Eve here to tell us a little bit more about that.
Thank you. Good morning. Very glad to be here. So I am here to talk with you about something a little bit different, not specifically focused on housing. But we know that in our community, we do not have adequate access to behavioral health services. We also know that people who are struggling with substance abuse or with mental illness, particularly mental illness that is serious and persistent, have a much more difficult time maintaining housing than individuals who do not experience these challenges. So we need to be increasing access to services. And it's not just Lane County. The state of Oregon consistently ranks 40th, 45th, 48th compared to other states in the nation around access to behavioral health services. Now, behavioral health includes two things: substance abuse treatment and mental illness treatment. So when you hear behavioral health, it's those two things combined. But when you look at access for adults and youth, substance abuse treatment and mental health treatment, we are consistently at the bottom in the country. And if we could advance the slides, that would be wonderful. So I'm here today to talk with you about a project that we are working on in Lane County that is called the Stabilization Center, a new facility, new behavioral health treatment service that we would like to have up and running, ideally by 2025, but we'll talk about some headwinds related to that timeline. But we're working as hard as we can. Next slide. So, what is the problem that we are trying to solve? We know that individuals who begin to experience challenges related to mental health or substance abuse have very little access to early intervention treatments in our community. That can cause these conditions to become worse and worse without treatment, which ultimately results in a crisis. When an individual is in a crisis related to their behavioral health condition, often they call 911, and either EMS or law enforcement responds and takes individuals to the hospital, which is just really trying to evaluate whether someone is in immediate danger to themselves and needs hospitalization. If not, they often are discharged with an attempt to get access to treatment, and our hospitals in town do a really good job at this, and they also have a lot of people in the community to serve. Or the folks end up in jail, which, again, our sheriff and sheriff's office have done an amazing job of adding treatment services to the jail. But our emergency systems are strained, trying to provide behavioral health services that we don't have available elsewhere in the community. All of this leads to cycles of individuals who are coming in and out of the system, experiencing crisis, and resulting in a safety impact, both for those individuals who are in crisis and for the community broadly. Next slide. So the goal of the Stabilization Center is to reduce incarceration and ED admissions by providing immediate access to behavioral health treatment in a setting where individuals they're not rushed to get out of treatment. We keep them there, stabilize them, coordinate resources, get them connected, and transport them to their next destination, wherever that may be. We ultimately believe that this will result in not only improved access to behavioral health treatment, but improved safety within our community and cost savings ultimately with the system. So what are we doing? We are creating a 24/7 drop-in facility that will provide trauma-informed and person-centered care. And this is really important because people who experience behavioral health crisis experience trauma on a regular basis. And we know that we need to have people who are very specially trained in addressing trauma who are working with these individuals. And that was addressed in presentations earlier as well. Who will we be serving? Anybody from birth to death, regardless of payer type or ability to pay. Folks will access our services. They can walk in, just like an emergency room, they could walk in. They could be transported by mobile crisis, by EMS, by the police. They could be referred from a community agency, and they might also be stepping down from a higher level of care. We know, for example, that we have individuals staying in an inpatient level of care longer than they need to in our community because we don't have access to the right types of behavioral, residential treatments or other facilities to step people down. So we want to be able to provide a certain amount of that step-down facility capabilities as well. Where will it be located? Right now the plan is on the MLK Junior Boulevard campus for Lane County, and for those who like landmarks, it's kind of right across the street from Autzen Stadium. We have a big grassy area there and a number of behavioral health services already on campus, which will really enhance our ability to coordinate care. And I mentioned we hope to open this in 2025. We are working through regulatory challenges. This will be the first high-level stabilization center of this magnitude in the state. We need to work through a lot of questions with the Oregon Health Authority around the regulatory pieces of this. And there's also the funding pieces. We are short on funding at this point, both for capital and operating expenses, but we're doing a lot of work and outreach. And why? Because this facility is necessary in our community to be added as a part of our system. Next slide. So we'll be providing several different programs within the Stabilization Center. This gives you the number of beds for the different programs. But for adults and youth, we will have short-term options. So the short-term in this respect is 23 hours or less of care. Would be the shortest term group of folks who just need crisis respite. And then for those who need a longer stay, ideally not more than a week, but potentially up to 30 days, we would have beds available for adults. And youth are unique because when you treat youth, it's not just the youth you're treating, it's their whole family. So we will have beds available for folks and private spaces so that youth and families can be together. And here is the crisis system. That it's important to recognize we are building a part of a system, but no part of this system can operate independently. There is no solution that is a panacea to this problem. Ultimately, the Stabilization Center will add to the system in our community. So the goal here is that we are creating, when you look at the top part of this system, a response for behavioral health that is on par with the response that we have developed over time around physical health emergencies. So if you have a heart attack, you call 911, that's the call line, you get an emergency response with EMS, and you go to the emergency room. And we have tried to do that with behavioral health using the same system, and it's been a struggle. So what we're doing now is building out the system as specific to behavioral health, where you call 988 when you are in behavioral health crisis or another crisis line. You have mobile crisis response, people who are specifically trained to manage behavioral health crises, who respond to you, and you can go to a stabilization center to receive treatment that is specific to your particular condition. Now, this doesn't eliminate the need for any of the other important parts of the system. All of the outpatient and walk-in services that we have available, the emergency room and inpatient behavioral health still is necessary as part of the system for people who have very, very severe crises. And also, the jail is part of our system particularly for individuals who are choosing not to engage in treatment and are presenting a safety risk for our community. That's the accountability piece of this system, though the intent is that when we provide treatment options, those options will become better choices for folks. Next slide. Okay, so if you are interested in learning more, you can scan that QR code with your cell phone, and it'll take you right to our website where you can sign up for our newsletter, you can send us comments and messages and emails, or you can just take down the website and the email address right there. We'd be happy to come and speak at any other community engagements or organizational settings that you have. We're trying to get the word out and gather community support because this is part of that broad community solution. All right, thank you.